Hi, my name is Dr. Ujjwal Chake, and we have Chris. Chris is a student physical therapist from George Washington University. And today we're going to talk about and perform evaluation for a lower extremity. So it doesn't matter what diagnosis it is, we're going to divide our evaluation technique and assessment as upper body and lower body. This is for the lower body. So we'll just take a case of a knee pain, so it doesn't matter if it's a knee pain, hip pain, low back pain, or ankle pain. We will go through the same set of evaluation techniques and assessment. So first thing I'll do is I'll ask a bunch of questions to make sure they rule out the red flags, understanding symptoms and everything. And next thing I'll do is some evaluations. So I'll just stand for me. Okay, first thing I'll see is gait. I want to walk for like 5 steps and come back. I'm looking for a big thing here, so I'm looking for his gait, the way his symmetry is. Go ahead and walk on this heel for me for 5 steps, and walk on the toes 5 steps. Again, I'm looking for a big thing, a symmetry and symptoms. Very good, stand straight. And immediately if somebody is doing pretty well, I'll go and challenge my testing now. So go ahead and stand on one leg for me. And stand on the other leg. Very good. I'm assessing the balance now. So since it doesn't matter if it's a knee, I want to make sure his spine is doing well. So I want you to go ahead and bend down, touch your toes. Again, looking for symptoms and symmetry. Come back and arch your back all the way. So instead of me asking him, does it hurt? Does it hurt? I'll ask him in any process, in a movement, if you have any symptoms, just let me know. Okay. Turn to your right side and left side, and stand straight and side bend to your right side and left side. Okay. Now I'm going to challenge a little bit of more functional movements now. From this, I will do more bilateral stuff, which is going to be, go ahead and squat for me if you can. I'm going to look at his quality, how well he squats, and how if there's any asymmetry with the squats, and looking for any symptoms if there's any squats with that, any pain in squats. A bilateral squat is pretty good. Then I'll say, go ahead and do a lunge for me. Very good. Again, I'm looking for quality and symptoms. If that passes and he's doing pretty okay with that, with very minimum symptoms, then I'm challenging him. Go ahead and show me a little bit of a jump from there. Okay, very good. Now that passes and they do pretty well in minimum symptoms, then I'll access, go ahead and do on a single leg. Very good. On the side too. Very good. In any of those assessments, I find a significant amount of symptoms with any of those previous tests, I would not go to other tests because I don't want to aggravate more symptoms there. I'll stop there, just kind of more functionally, I'm looking at what the patients are. Okay, so by this time, I'm already looking at what the standing position test will be, and then I'll have him sit. So as he's sitting, the first thing I'll look at is the palpations. So, and go ahead and put your hands right here. So I'm gonna look at the anterior tissues, kind of see if there's any pain and symptoms. In the meanwhile, I'm gonna do some sensation tests. So go ahead and tell me if you can feel this, feel the same. If you want to be a little more specific, you can have him patient close eyes too. Okay. Now, after this, I'm going to do some MMT to kind of look at how strong he is, and also if there's any symptom associated with this contractions. I'll have to kick the leg a little bit. So if it is a right leg, I would not test the right leg the first. I will try not to have any kind of false positive or false negative. So what I like to do is I'll test the other side first. So I'll have knee all the way up, knee all the way down. Very good. Hip goes up. Okay, hip inside, outside, outside, inside, ankle out, ankle in. See, since he already walked heel raises and toe raises, I don't have to test his ankle dorsiflexion and plantar flexions right here. Now I'm going to do the same thing over here. Go all the way up, all the way down. Inside, outside, hip up. Very good. So during the process of any muscle testing, if I find something to be positive, for example, knee extension, go ahead, it's painful here, I try to see, all right, first thing is, where is the pain? I'm going to ask the patient, and they will tell me exactly what the pain location is. Next thing I would try to do is do the same contraction in a different position now. So for example, it was in a 45 degrees right here. Go ahead. I'm going to try to contract the same thing in a different degrees, maybe like a knee extension in 0 degrees. Go ahead. And go to more flex position, do the same thing again, to see if they all produce the same symptoms or the symptom changes with a different range. that will give me some information. With that information, I can have a better idea, like, all right, where to go next for the testing. Okay, so any lower body extremity testing, I would like to test a slump test or SLR test, either or both, just to kind of rule out any kind of spinal pathology being associated with that. Okay, go and sit up straight for me, hand behind. Okay, and give me a slouch position, head down all the way, and then I'm gonna have him sit over here, and I'm gonna ask the patient if they have any pain going down the legs, numbness and tingling, anything like that. Okay, relax. You're pretty good there. Go ahead and lay down on your back for me. For the sake of the video, I'm gonna focus more on the left side, so you can have more access to this. So the first thing I'm gonna look at is looking at the leg length, gonna see everything is okay here. And after that, I'm gonna have him do all the way straight leg raise. And then I'm gonna bend the knees and work on the hips a little bit. Do a little bit of scour both ways, a little bit of fader, and then go back to knees and knee flexion over pressure, knee extension over pressure. Might as well I do a little bit of valgus and varus, and a little bit of that pivot shift testing right here. Very good. So I'll do on the both sides, and based on that, I will get some information. And if I get some information, I will dig deeper into palpations. So like, for example, if the pain is in the medial knee, I'll say, like, so what else out there which would cause symptoms in the medial knee, right? So you could have an MCL. I can do a same testing, which I already did. I can contract the adductors. Go ahead and contract the adductors. I can contract the quad, which is going to be your VMO, and I can also do a little bit of a varus testing to compress the cartilage, Now that will give me some information, like, what tissue is being affected more. Okay, since I'm already here, I can do a little bit of a side testing. Might as well organ testing as appropriate. Lay in his stomach for me. And it's always good to rule in and rule out any kind of spinal pathology. So you ask question, does the back hurt? Any numbness and tingling down the legs? Do any PA stress all the way down to the sacrum and coccyx? I always ask permission. Is it okay if I touch here? Very good. Again, palpations. Very good. Now I can do a quick contraction of the glutes. Go ahead and squeeze your glutes right here and lift the leg up. Hold it there. I'm going to push it down. Again, I'm looking for contraction. I'm looking for symptoms here. Okay, go all the way up here. Very good. Okay, now next to a sideline positions, for the sake of video, we'll do this side. Keep your legs straight and lift the leg up. Hold it there. Very good. So with this test, I'm looking for more like a TFL and a lot of quads. If I want to do a little more of the lateral glutes, I can roll over a little bit. Hold it there and then you push down. Okay. Again, I'm looking for symptoms. I'm looking for quality of contractions. Okay. Very good. Okay, have a seat. Thank you.